Hi friends, once again welcome to another episode of our future midwife. In the last class I discussed about the minor ailments of newborn. In this class I have a plan to include the reflexes and milestones of newborn. This topic will be very useful for the nursing students. Usually, newborn assessment along with the reflexes are the 100% sure question for the nursing students when they are appearing in the practical exam, especially in the pediatric practical exam. So, I hope this video will be useful for the nursing students. So, without wasting time, we can move on to today's topic, reflexes and milestones of newborn. A reflex is an involuntary or automatic response to stimulus without our awareness. Usually this neonatal reflexes, otherwise it is called primitive reflexes, are the inborn behavioral pattern of newborn which is developed during the intrauterine life. It should be fully developed at the time of birth and gradually inhibited by the higher centers of brain during postnatal life. Newborn exhibit several reflexes which is very crucial for the survival and development of the baby. These reflexes gradually fade once the nervous system become mature. Newborn reflexes generally categorized into three: general body reflex, oral reflex and facial reflex. The facial reflex again categorized into three: blink reflex, doll's eye reflexes and auditory orienting reflex. When it comes to the oral reflex, which include rooting reflex, sucking reflex, swallowing reflex, gag reflex and cry reflex. When it comes to the general body reflex, which include Moro reflex, palmar reflex, plantar reflex, walking or stepping reflex, asymmetric tonic neck reflex, symmetric tonic neck reflex, Babinski reflex, Babkin reflex, parachute reflex, Gallant's reflex, etc. When we think about the examination point of view, one who answered the reflexes, we should remember three things: the name of the reflex, its response and when it disappears. Among the several categories, now I will discuss about few important reflexes for you. First, we will see about the grasp reflexes. These grasp reflexes which include palmar and plantar grasp reflexes. The first one is grasp reflexes, that is palmar reflex. In palmar reflex, when placing a finger or stroking the inside of the infant's palm, the infant hand will close around it. It will disappear about 4 to 6 months of age. Next one is plantar grasp. When a finger is placed under the toe will curve. This reflexes will disappear about 9 months to 1 year of age. Next one is Moro reflex. When the infant hears a sudden loud noise or experiences unexpected movement, the infant will extend the arms with the palms up and then move the arms back to the body. Sometimes this reflex is followed by crying. This reflex will disappear about 6 months of age. Next one is rooting reflex. When the infant's cheeks or side of mouth is stroked, the head will turn towards it and the infant's mouth will open in an attempt to suck. This helps the babies find the food source when feeding. This reflex will disappear about 4 months of age. Next we will see about sucking reflex. When something touches the top of the infant's mouth, the infant will begin to suck. It will be disappears about 4 months of age. Next one is Babinski reflex. When the bottom of the foot is stroked from the heel upward along the outward part of the foot, the big toe dorsiflexes and the other toe fans or spread out. This Babinski reflex will be fade about 1 year of age. Next one is crawling reflex. When the infant is placed on the stomach and pressure is applied to the sole of the foot, the infant will attempt to push against the hand and move the arms and legs in a crawling-like motion. It will disappear few weeks to months after birth. Next one is step reflex. When holding the infant upright with the leg and feet touching a surface, the infant will move the leg like taking steps or walking. It will disappear about 3 to 4 months of age. Next one is tonic neck reflex. When infant's head is turned to a particular side, the leg and arm on that side will extend, while the leg and arm on the opposite side will flex. It will disappear about 4 months of age. Next is the parachute reflex. Reflex appears at about 6 to 9 months and persists thereafter, elicited by holding the child in ventral suspension and suddenly lowering him to the couch. Arms extend as a defensive reaction. The clinical significance are if it is absent or abnormal in children with cerebral palsy, it would be asymmetrical in spastic hemiplegia. Next is the symmetric tonic neck reflex. Extension of the head causes extension of the forelimbs and the flexion of the hind limbs. Evidence between 2 to 3 months of age. The clinical significance are not normally easily seen or elicited in normal infants. May be seen in an exaggerated form in many children with the cerebral palsy. Next is the Gallen's reflex. Firm sharp stimulation alongside of the spine with the fingernails or a pin produces contraction of the underlying muscles and curving of the back. Responses is easily seen when the infant is held upright and the trunk movement is unrestricted. Best seen in neonatal period and thereafter gradually fades. Next we will see the blink reflex. A bright light suddenly shone into the eyes, a puff of air upon the sensitive cornea or sudden loud noise will produce immediately blinking of the eyes. The main purpose is to protect the eye from the foreign bodies and bright light. May be associated tension of the neck muscle, turning of the head away from the stimulus followed by crying. Reflexes are easily seen in the neonate and continue to be present throughout life. Next one is doll's eye reflex. Passive turning of the head of the newborn leaves the eye behind. A distinct time lag occurs before the eye moves to a new position in keeping with the head position. It disappears within 1 or 2 weeks after birth. Failure of this reflex to appear indicate a cerebral lesion. The last one is cry reflex, non-conditional reflex which accounts for its lack of its individual character. It is sporadic in nature. Usually it starts as early as 21 to 29 weeks of intrauterine life. Now we will move on to the next topic of our today's section, that is developmental milestone. Actually, what do you mean by development? It is the process of functional and physiological maturation of an individual. When it comes to the developmental milestone, this is a certain kind of ability that the newborn or the baby has to attain according to the age wise. So when it comes to the milestone, which include the physical, social, emotional, cognitive and communicational skill. Here I will explain the normal developmental milestone according to the age wise with the help of a slide. So first one is social smile. So social smile develop between 0 to 3 months of age. Next one is neck holding. So this neck holding will develop between 2 to 3 months of age. Next one is rolling in supine to prone and prone to supine, which attain between 4 to 6 months. Creeping will attain between 6 to 8 months. Crawling will attain between 6 to 8 months. The quadruped will be attained between 7 to 9 months of age. Half kneeling can be occur in between 9 to 11 months of age. Kneeling will be occurs between the age of 9 to 11 months. Sitting with support will occur in between 4 to 7 months, whereas sitting without support will occur between 5 to 9 months of age. Standing with support will occur between 10 to 12 months, and without support will occur between 11 to 12 months. Walking with support can be attained between 10 to 12 months of age, whereas without support can occur between 12 to 15 months of age. Running can be attained between the months of 19 to 20. The jumping will be occurs in between 23 to 24 months. The detailed explanation of domains of developmental milestone will be displayed on the slide. Please have a look on it. I think we can wind up our today's section. In this video, I explain most of the reflexes. So in the next class, we will meet with another topic of midwifery. Till that, take care. Bye bye.